The disorder I was given was prosopagnosia. Prosopagnosia is the inability to recognize faces. Um, Prosopagnosia derives from the Greek word prospan, meaning face, and agnesia, meaning ignorance. Prosopagnosia is basically the result of abnormalities or impairments in the brain. The fusiform gyrus, which is a fold in the brain that coordinates the neural systems that control your ability to perceive faces and remember faces. And it's damaged, and you're not able to recognize those faces with this disorder. Um, Stroke, traumatic brain injury, neurodegenerative diseases are some links to this disorder, but it does not include memory dysfunction or memory loss or learning disabilities, which a lot of people may feel is part of this, but does not go along with this disorder. 1 in 50 or 2% of the population have some degree of this order, but go their whole lives going undiagnosed and they just deal with it. Um, with prosopagnosia, you will not recognize familiar faces like your mother, your father, your brother, your neighbor, your teachers, your co-workers, your boss. When you're out of context, if you're just walking on the road, you could walk past them like you've never seen them before, like you didn't know them from Adam. A person with this disorder often becomes clingy in social situations due to the fact that they don't recognize anybody, or they can also become absolutely withdrawn due to social anxiety or the fear of being laughed at because they don't know or recognize people. People with prosopagnosia also have difficulties following along in movies or TV series because they cannot recognize characters or keep up with them. People with prosopagnosia also are not good socially with friends. They will withdraw, and they will not maintain relationships due to embarrassment of not being able to recognize faces. The ways to diagnose prosopagnosia would be a Benton Visual Retention Test, which is administered by a doctor. Basically, they give you a whole bunch of objects and you name them off and you try to remember what they are. You can also be diagnosed if you've had stroke or if you have epilepsy. This can cause the damage in your brain that causes prosopagnosia. And a lot of times, once you've had a stroke or there's the neurodegenerate disorder in your brain, such as epilepsy, it's unlikely that you will gain back your face recognition once you lose it. Um, the doctors can also go off your daily activities of living. If you go through life and you're not able to focus on knowing who people are, you can walk past them and not know who they are, and this is a common thing with you, then you definitely need to be tested for this disorder. There's also different degrees of prosopagnosia. You have acquired, which is again the stroke or the epilepsy, or you have developmental. Developmental is newer to the prosopagnosia disorder. It's just now coming to light that there are children that are born with this disease. It has been misdiagnosed as autism spectrum disorder. Relating the two can lead to insights also about selective developmental deficits like dyslexia and dyscalculia. Dyslexia is where you mix up your letters and it confuses you when you're trying to read. Dyscalculia is when you mix up your numbers and you can't do math. Also, to specific language impairment, and by figuring out the commonalities of the developmental prosopagnosia and the autism and the dyslexia and the dyscalculia, we can identify the commonalities that exist between the disorders and possibly get more children diagnosed correctly. 2 to 29% of the population of people with prosopagnosia are drawn from adult diagnosis, and researchers believe that millions of children worldwide do suffer from this disorder, and could possibly bring to light more ways for it to be dealt with and diagnosed. Some of the nursing problems that you may deal with being a nurse will be the social anxiety aspect of this disorder. The patient will have a severe fear of social situations and a fear of being judged or humiliated in front of groups of people, because people will walk up and know you, but you won't know them. The patient may experience signs and symptoms of anxiety, heavy breathing, sweating, a rapid heart rate. The patient may also fear interacting with people, so it may be harder for you as a nurse to get your patient to open up to you, because they may not be able to recognize you every time you see them. You may have to reintroduce yourself and remind them of who you are. Depression is a common thing with prosopagnosia because of the fear and anxiety that comes along with not knowing who the people are around you. It leads to feelings of helplessness, worthlessness, fatigue, appetite loss, patients may experience irritability, restlessness, or they could even get violent if it came to that extreme due to anger and frustration of not being able to recognize loved ones. Some interventions that a nurse may be able to do to help a patient is, first and foremost, you want to establish a therapeutic relationship with your patient. Getting the patient to open up to you, getting the patient to feel comfortable around you, teaching the patient some signs that they can remember you by. Maybe you have a tattoo, maybe you have a mole on your nose, maybe you have a certain eye color or a certain hairdo, and you can teach your patient to remember those things so they recognize you and they can learn to trust you. Psychotherapy is a big one in this disorder. Talking to somebody and expressing your frustrations and expressing your fears and expressing your anxieties is very important with this disorder. Holding it all in will only lead to depression, which can make it worse for you in social situations, and it can cause the client to completely withdraw. Adhering to the patient's treatment plan and following the provider's guidelines would be a pertinent intervention, because the doctor may prescribe anxiety medicines and the doctor may prescribe psychotherapy for the patient, and the doctor may ask you to teach a client how to recognize people in different ways and teach them coping skills. A big one that I feel is important is being available for the patient, letting the patient know that you are there for them, letting the patient know that if they need you to sit with them, if they need you to talk to them, if they need you to talk to a family member for them because they're embarrassed, you being there fully for them is very important as far as their mental health goes, because it's a very embarrassing disorder to have. And getting the patient to stay positive and to know that there are ways to cope with this disorder and there are ways to get beyond this disorder and get back into social situations and get back to work, and teaching them how to not let the anxiety and the stress get to them, but to focus on things that they can get to know about people that will alert their other senses to teach them who people are. Implementing your interventions is very important. Staying consistent with your patient is very important. Reiterating the fact that there are many different ways to remember a face, especially nowadays. Someone could have blue hair, someone could have purple hair. A lot of people wear glasses. Some people have 3 or 4 earring holes in their ears. People have nose rings. People have Marilyn Monroe piercings. Just things like that that could trigger someone's mind to remember who a person is, so they are less anxious when they're around a group of people and they don't feel the need to withdraw. Therapy is a huge one. Going to therapy will help with the social awkwardness, teaching them how to be able to socialize again and not feel awkward and not feel like they want to run away. Being able to go shopping, being able to go to social gatherings, being able to go to family gatherings again, can all come with therapy. It usually takes around 12 to 13 visits before the therapy will begin to take its effect, but it's worth it. And again, staying positive. Always teach your client that having a positive outlook and focusing on what is good about what they're learning, what's good about what they learned in therapy, the going over what they remember about certain people's features, who they want to remember the most, and who's most important to them to remember, and maybe writing down and reminding them or showing them pictures, helping them take pictures maybe with their phone of loved ones that come and see them, and then going over things that they can remember so when they come they can remember their face. There is no actual cure for prosopagnosia. Therapy is the only real intervention that they have. All you can do is learn coping skills and keeping a positive attitude and going to therapy consistently will help you with this disorder. The underlying disorder of social anxiety and depression that do come along with this disorder, the doctor may prescribe antidepressants. They are an option to deal with the emotional problems that you have. You could feel fatigue, you could feel sadness, you can lose your appetite from the stress. There are SSRIs such as Paxil. Paxil will increase the level of serotonin in your brain, and that will help with your anxiety. As far as having to go in social situations, if it is pertinent that you work and you stay in a working environment, or if you have a large family that you are constantly around and it causes you a great deal of stress and anxiety, this may be good for you. There are beta blockers like propanol. They help with the adrenaline rush. That's also for anxiety. So you won't hyperventilate and you can be calm and you'll be able to have your coping techniques and you'll be able to think clearly. So maybe you can look at someone's face and recognize the different things that you went over with your nurse, to recognize people's faces. but you won't feel so stressed out about it. And there's also anti-anxiety medications such as Valium, but you don't want to actually have to be on those. Those are for highly, probably severely disordered people. All in all, with prosopagnosia, you want to make sure as a nurse that you assist the client and reiterate a treatment plan, reiterate teachings as far as assisting the client to identify ways to recognize people in their life, assist the client to identify positive feelings to begin to deal with their anxiety, their depression, and their social withdrawal. Sorry. Always be available for the client. And just make sure that they are going to therapy while they're in your care, and possibly going to supportive counseling, and make sure you're promoting them to get back into social situations so they can put to use the teachings that you taught them, and they'll be on their way to good health.